Hi, this is Dr. Lisa Abell for PureMedicine.com, and today I want to talk to you about why treating patients via FaceTime, Skype, and over the phone works. Healing doesn't come from a person, another person, or a doctor's office, or anything like that. Actually, healing comes from within the organism. I always give an example of a seed, that if you plant a seed and the plant grows and there's lots of holes in the plant, what happens is that we want to look at the soil and we want to say, oh, you know, what kind of nutrients are missing from that soil? What's going on with it? What can we change in order to allow that plant to heal itself? And when we do that and change a few things and add nutrients in the soil, it's not an instantaneous healing, but eventually, if you do the right things, we get the right results. Healing happens from within each and every individual. It doesn't happen by going to a doctor's office. So I give an example of our patients that we had a clinic for over 20 years in California, and patients saw us and we gave them remedies, and then they went home. And when they went home, step by step, every day, those remedies were regulating the plumbing, rebuilding the organism with the vitamins and nutrients, and regulating their stress. Thereby, the body was healing, removing its trash or its toxins, and the body was healing itself. And so there's no difference between a patient seeing us via FaceTime or Skype, or even over the phone, and treating them in an office where we are. Because healing actually comes from a source, and a source within each and every individual. And by understanding these natural laws, and that's what Dr. Abell and I follow, it's not our random ideas of, you know, oh, I need to give this mineral and this nutrient, and oh, maybe this is going to work. We don't do that. We actually energetically test. We see how the plumbing of each organ, tissue, and gland are working, and there's a right order and a right timing to everything that Dr. Abell and I do. So if a person has large amounts of stress, we need to regulate that temperament. If they don't, we don't need to regulate that temperament. If a patient has a lot of suppression and a lot of medications, we have to work on binding out and removing these medications. If a patient has serious dysbiosis, we change that. But it doesn't occur in a doctor's office. It actually occurs by the work that we do with the 4 steps of our protocol, which is regulating the temperament and the stress of the individual, cleaning out the plumbing, supporting the vitamins, minerals, amino acids, and nutrients that are from the individual's needs rather than general needs, and then also certain support that we add, for example, taking baths, adding fermented foods, and things like that. And these sorts of things regulate the self-healing capacity of the patient. So hopefully this was helpful for you, and why Dr. Abell and I have the ability to help you to heal, because healing doesn't come from a doctor's office, and healing actually doesn't come from taking the wrong nutrients. Healing comes from doing things in the right timing, in the right order, with the right nutrients, and with the right support. So thank you for listening. This is Dr. Lisa Abell for PureMedicine.com.